Hi, I'm Dr. Jay Iyengar, an orthopedic surgeon at Adventist Health Lodi Memorial and founder of the Stockton Shoulder Institute. In this video, I'll be talking to you specifically about arthroscopic shoulder surgery. I'll talk about the basics of arthroscopy and what happens before, during, and after surgery. So let's begin. Shoulder arthroscopy is surgery done using a camera and specialized tools through small incisions to repair damage within the shoulder joint. By utilizing this technique, surgical treatment can be performed in minimally invasive fashion without requiring an incision to open the shoulder. The shoulder has several specialized soft tissues, such as the rotator cuff, labrum, capsule, and biceps tendon that help move and stabilize the joint. These tissues can be damaged through injury or repetitive use and sometimes require surgical repair. The shoulder joint itself can also suffer wear and tear of the cartilage surfaces. This is called arthritis, and in early stages can be treated with arthroscopic surgery. In most cases, I will initially recommend non-surgical treatment, such as physical therapy to improve range of motion and strengthen the shoulder, oral medications to treat inflammation, and cortisone shots to help decrease joint pain. But if these treatments do not improve your shoulder pain, or if the damage to your shoulder is more extensive, then it's time to consider arthroscopic surgery. In this procedure, a small camera is first inserted into the back of the shoulder through a tiny incision. Instruments are then brought into the front of the shoulder using another small incision to perform any necessary repairs. Once the work is completed within the joint, the camera is then moved to the subacromial space on the side of the shoulder. This space lies between the rotator cuff tendon and the shoulder blade, and this is where we can identify and treat rotator cuff tears, inflammation of the shoulder bursa, and bony spurs that cause impingement. The main goals of arthroscopic surgery are to repair damaged tissues to allow them to heal properly, and remove tissue that is inflamed or scarred to relieve pain and improve range of motion. Prior to surgery, you will have a medical evaluation that includes blood work and an EKG to check your heart function. If you have a known heart condition, I will send you to a cardiologist to make sure your heart is healthy enough to undergo surgery. With arthroscopic surgery, it is very important to make sure that any other medical conditions, such as diabetes and thyroid disease, are well controlled in order to optimize your recovery after surgery. It is also important to stop any medications that can thin your blood, such as aspirin, warfarin, Plavix, or Xarelto, that may cause bleeding after surgery. I also recommend patients stop taking anti-inflammatory medications, such as ibuprofen or naproxen, that can also increase bleeding risk. I like to remind patients that it is important to have someone stay with you for up to a week after surgery to help you prepare meals, get dressed, and help you with normal activities of living. I would like to go over the basics of the procedure, but keep in mind, I will give you a full checklist of instructions telling you what to do to prepare for surgery during your pre-surgical visit. After your check-in to the hospital or surgery center, I will meet you in the pre-surgery room and put a mark on your shoulder to confirm the correct side. This is done as a routine safety measure. You will then meet with the anesthesia team, and they will discuss with you the plan for anesthesia for your surgery. The procedure is performed using a combination of a nerve block to numb the arm and also a light general anesthesia so that you are asleep during surgery. A nerve block is numbing medication placed around the nerves in your shoulder before the procedure that blocks feeling in the shoulder and arm. This is an important part of preventing pain during and after the surgery. The surgery itself takes about 1 hour and is done through small cosmetic incisions in the front, back, and side of your shoulder to insert the camera and specialized tools. By avoiding an open incision, this allows for a faster postoperative recovery and less pain with rehabilitation. With any procedure, there are always risks, although thankfully with shoulder arthroscopy, complications occur in less than 1% of cases. The risks of the surgery include infection, bleeding, nerve damage, blood clots, and the risks associated with anesthesia. We will take several measures to prevent these complications from happening, but there's still a small risk. After surgery, there's also a risk that you could re-injure any tissues that have been repaired. That is why it's so important to wear your sling as directed. There's also a possibility that your shoulder joint can get stiff. This is why it's important to do physical therapy as instructed. When you wake up in the recovery room after surgery, your arm will be in a sling to support the shoulder and will still feel numb from the anesthesia. At this point, you will be monitored in the recovery room to check your vital signs and make sure your pain is well controlled. A nurse or physical therapist will help you get out of bed and make sure you are safe to walk with assistance. At this point, most patients are ready for discharge home from the hospital. Once you're home, you will keep your shoulder in a sling for the first week, including when you sleep, to allow the muscles to heal. Keep in mind, it is normal to have numbness in the arm, hand, and fingers for up to 24 hours after surgery as the nerve block slowly wears off. You will be given a pain medication prescription at your appointment before surgery. Please start taking your pain medication once you get home as instructed. This helps keep your pain under control as the nerve block wears off. Icing the shoulder is also a very important part of minimizing pain and swelling after shoulder arthroscopy. This can be done using ice packs or frozen peas, but a cold therapy unit is the most effective way to ice the shoulder after surgery and during rehabilitation. I recommend sleeping in a recliner or comfortable chair for the first 2 weeks, as this is a more comfortable position than sleeping flat. After 3 days, the surgical dressings can be removed and you may begin showering normally. Keep in mind, I still recommend that you avoid soaking the incision, such as in a bathtub or a pool, for the first month after surgery until the incisions are fully healed. I will let you know what your instructions are for shoulder movement after surgery, and your discharge instructions will specifically tell you whether I want you to move the shoulder right away. In some cases, such as rotator cuff or labrum repair, I do not want you to move the shoulder in the first week and recommend wearing the sling at all times unless you're showering. In other cases, such as release of a stiff or frozen shoulder, it is important to start moving the shoulder right away after surgery. In this case, you will be taught simple range of motion exercises in the recovery room before you are discharged. Usually, during our first post-surgery visit, we will review the pictures from surgery to explain what exactly was done, and we will start physical therapy to help move your shoulder safely and gradually strengthen your shoulder muscles. I hope this video has provided some valuable information regarding your shoulder arthroscopy procedure. Thank you for your time, and if at any point you have any questions or concerns, please do not hesitate to ask me.